if you've been stretching your piriformis for months and nothing happens, it's probably not your piriformis. Deep glute pain is more often a pelvic stability issue. So here's your pelvis, and your piriformis is a lateral rotator. It moves your foot outward. It's a lateral rotation. It's a muscle that belongs here, attaching your sacrum to your leg. So when it is tight, then the question you want to ask is, well, why is it tight? For you to just go isolate an area and try to stretch it is a waste of time, because you're not addressing the why behind the tightness. When it's a chronic piriformis issue, this can turn into pelvic floor dysfunction, because when there is a lack of performance or exhaustion of a muscle, the brain goes to the helpers, and those are your obturator internus and externus, which directly influence your pelvic floor and complications that come with it. So going back to the piriformis, you got to understand that when your pelvis is not stable, then there is compensation, and there is a dysfunctional patterns of movement as a result of this compensation. The compensation in this case may require your piriformis to overwork. So then what you want to do is, you don't want to just go and stretch it. You want to find out what the level of instability is and try to fix it. So the fix that I use in my practice, when it comes to movement patterns, is always developmental exercises. These are the exercises that you and I and every walking human being on the planet Earth has done to become stabilized. We were born as a baby. We could barely hold our heads up. We all became running toddlers with no bands, no weights, no gyms, no guidance whatsoever. Our brain is hardwired to do it. Our body parts know exactly what their roles are. When the environment is not conducive for the right way to do things, compensation takes place, and the result of compensation is always weakness and always tension in specific parts of the body, depending on the compensation. So developmental exercises are the way, and that starts with biological breathing. Biological breathing is something I've talked about forever. If you have not subscribed to my channel, make sure you do, but we will make sure that we put it at the end of this video so you get to see it. You gotta provide the right environment for the body, and that starts with breathing. I'm not gonna get into the breathing part, just watch that video at the end. Make sure you subscribe to the channel. But you do that, but don't think that's gonna solve your problem. Now we need to find the stability, or instability I should say, and then tackle it with developmental exercises. So the question I have for you is, how long have you been dealing with your problem? How chronic is this condition that you're having, and what have you done about it? Make sure you put in the comment section below, because I actually do read these comments and I do respond to them for sure, unless they're silly and inappropriate. Make sure, if you need help, contact me using the description box. Somewhere there is a contact link that you can contact me, and we can look into this and figure out what is going on. Thank you so much for watching. Make sure you subscribe, and until next time, take care.